Hi, I'm Kate Marie and I'm at Dr Bruce Williamson's clinic, and I'm here today to look at what I can do about my face. I'm finding now that I'm losing a lot of fat around my face and shrinking a lot, and people keep saying to me, oh my god, you're losing too much weight, you need to put on some weight. Well, the reality is I'm at a good weight. I'm quite lean and I don't want to get any fatter, but I don't want to look like a skeleton. So I thought I'd come and see what I can do to perhaps stimulate some of this tissue growth. I don't know if that's possible these days, but I'm hoping that if I can at least address it now, if we do get a breakthrough in the future, then I might be able to, I don't know, have a better chance of staying a bit more intact when I'm 100. Come with me and we're going to go and talk to Bruce, and we'll interrogate him about what happens to your face, what you can do about slowing the aging process in your face, and ensuring that you've got skin that's going to last a distance as you get older. I think one of the big issues with getting this work done is you really don't know how it's impacting you, and you need markers. So having a photography studio like this makes a huge difference. And because, you know, we look in the mirror and what you see is not really what's there, because a lot of us have got body dysmorphic problems. So yeah, I think this is a really good thing to do, so you can see some progress, because there's no other way you can see whether your skin's changing apart from people saying, oh my god, you look better. First thing we do before we start this procedure is we're going to be putting some numbing cream on the face, because it's going to be needle heaven here, so we don't want to feel anything. So we use numbing cream, and then we're also going to use some gas. Okay, we're talking to Bruce now about what happens to the aging face and why you'd use fillers or these volumizers from a medical perspective. We're not talking about younger you here. What I'm concerned about is the facial shrinking that's going on. Why am I losing all this fat? And what does the filler do in terms of
well, as we age, we lose tissue, and we lose not only soft tissue, but we lose bone as well. So the first thing you're losing under there is bone, and that happens as we age. Then we've got soft tissue over that in the form of muscle, and then we've got some fat over the top of that. Now you're very lean, Kate, which is a good thing, but that often means that you've lost some of the fat out of your face. And we start to get separation between fat pads that looked like they were continuous fat when we were younger. The main areas that we tend to lose, we get a hollowing out of the temples, and that's what we're going to address, one of the things we're going to address with you this morning. And that can give you a scooped out, skeletalized appearance up there. You can also get a loss of volume along the orbital rim, and as that you age, the actual orbit changes shape. It gets bigger and it drops down more as a trapezoid rather than as a square. And that causes a loss of volume under the eye, which exposes the orbital rim. So we'll put a little bit of filler just along the orbital rim to hide that. And then also as we age, we get a separation in the fat pads down through the middle of the cheek. And that gives you that drawn appearance with this flatness here and this overhang, which gives you the nasolabial fold. So you've had some filler in there in the past. We may put a little bit more in there for you today just to keep that going. And then another area that tends to happen as you that tends to lose volume as you age is along the jawline, and you get a loss of volume in the corners of the mouth with the lips turning, the corner of the lips turning in, and a sculpted out appearance in the chin. Once again, you've had a little bit of filler in there already, but we may put a little bit more in there for you today. Okay. So those are the things we're going to address.
So tell me, we're using, what filler are we using today?
We're using a range of fillers called Tearcell, which come from Switzerland. They're a range of hyaluronic acid fillers. We're using 3 products out of their range. We're using Ultra Deep, which is their thick product, which we're going to use for recontouring your temples. We're using another product called Ultimate, which is a medium density product, which we're going to use in the nasolabials and the mid-face. And then we're using a product called Redensity 1, which we're going to inject. It's a very thin, non-cross-linked hyaluronic acid filler, which we're going to inject as a sheet over the skin.
Right. So are there any possible side effects?
Whenever you stick needles into the skin, there's always the possibility of getting infection or bruising, or I should say bruising or infection. You may well get some little bruises. Bruises will go away. Infection is very rare with this type of thing if we follow normal aseptic procedures and we use good technique. There are very rare complications with this type of thing, but most of the time hyaluronic acid fillers are very, very safe.
So here, sounding strange, laughing gas makes you sound strange, is nitrous oxide, which is really good because it goes in and out of your system very quickly.
We're just going to come in behind there. Little pinprick. Just inject a small amount. You see people have got a lot of temporal hollowing like that with the brow ridge starts to really, and it's almost like a drawing of themselves, you know. And then in women, you start to lose the outside of the eyebrow as well. It falls over the cliff. That's when you've got really bad temporal hollowing, when you look straight at someone and you can't see the outside of the eyebrow because it's actually behind the ridge there. So, okay, so that's just to restore that smooth contour around the jaw. There's a sausage of fat that sits down along the nasolabial fold. There's a fat pad that sits under the eye here, and there's a fat pad that sits up here. Those fat pads in a younger person look like they're continuous across the face with no gaps in between them. But as we age, and particularly if we don't carry excess weight, we'll tend to get separations between the fat pads. You get a separation under the eye, which gives you what's called the teardrop trough, which can lead to the appearance of a sunken eye and a long bottom eyelid. You also get the fat pad that overhangs the nasolabial fold to give this deeper fold here, and you have this triangular fat pad and you end up with a separation down through here. So what I'm doing with the filler is blending those fat pads back together so they look continuous, which is the way it would have been when you were younger.
Now what we're doing is my face, where we plump up the skin and try and get some stimulation of the tissues underneath the skin.
So we're using a product, yes. So this is a product called the Vital Injector gun, and we're using a product called TSL Redensity 1, which is a non-cross-linked hyaluronic acid filler that has various collagen stimulating additives and properties. So we're injecting this with multiple tiny little needle punctures, evenly about 1.5 millimeters under the skin, right across Kate's face, to act as an injectable moisturizer, but also to stretch the surface of the skin and the fibroblast to stimulate them to produce collagen. And so this will be a somewhat an instant plumping up, but more also a long-term stimulation.
So how many needles on the gun?
There's 5 little needles in the shape of a 5 on a dice. And they go in under the skin to a very fixed depth, to a selectable depth, inject a very small amount of product and then come back out again. And the device also has a suction which pulls the skin up against the gun, which makes the needles go in cleanly through the skin.
So in my whole face, how many needles will go in?
It'll be somewhere around 1,000 needle punctures over the face.
For God's sake, I need the gas for that. God, 1,000 needles. Oh my God.
Fair bit of blood there, but we'll clean that off, and Kate will clean up very nicely there.
I'll clean up very nicely.
Actually, that top drawer just on that side, there should be more there. Okay, there's not a lot of aftercare with this. Probably for the first day or so, you want to be careful what you do, because there are little open wounds, probably 1,000 little needle punches on the face there. So what we're going to do is put a very thin layer of silicone gel over here now. That's my usual wound dressing after most of these. It seals the little holes back over again. So Kate, how would you describe that experience? Was it?
Well, if I didn't have the gas, I wouldn't like it.
Yeah, no.
The gas makes a massive difference.
Yeah, there's what we call needle fatigue from that many needle
With
pricks.
the gas, it's fine.
Yeah,
You just got to keep the gas up, because there's a delayed response with the gas.
And the gas also takes away the anticipation of any pain,
That's
which is a
it.
big thing with it.
Yeah.
A lot of that will be settled down by tomorrow, but I agree, that's pretty good. That'll be very, very minimal compared to something like a CO2 laser, where you look pretty, you can't leave the house for 4 or 5 days.
So in terms of the stimulation effect compared to CO2,
Different type of thing.
different type of thing. Yeah.
Ideally, you could have both. CO2 is kind of rejuvenation from the outside in, whereas this is more from the middle of the skin or the inside out. So CO2 is very good at getting rid of this, improving the surface quality of the skin.
Hi, 2 weeks later, after getting my face done with 1,000 needles, so much better. I feel like I'm a bit fresher. Look, I don't want to be vain, but you can see how this is plumped out now, and I'm not looking my normal skeletal self. So very, very happy with the results. My skin is glowing. People are saying, oh my God, you're looking fantastic. And my skin tone certainly has improved, and I'm feeling very happy. The fine lines that were appearing have gone away. So yeah, 100% love having that treatment with it. It was TSL in the top part of my face and throughout underneath the skin on the surface of my face. Yeah, I really recommend getting this kind of work done. Hopefully it will stimulate collagen long term, but in the meantime, certainly my face looks a lot fresher and my skin looks fantastic. So I'm very, very happy, highly recommend it. Thanks for watching. Please like or subscribe my channel, and I'll be back with more interesting things about the aging body and what you can do about it.